One night, I remember I woke up, it was 3 o'clock in the morning, like trying to catch my breath, and I didn't know why. Hi, my name is Jensen. I am a registered nurse. I have 10 years of experience. I currently work in New York City, and I have tested positive for COVID. I officially got the results yesterday, which was Friday the 3rd. I originally started to have symptoms on March 23rd. I felt achy and I had a cough. I was actually on my way to work on the 23rd at 5:30 in the morning. I figured it was just because I was tired from the weekend, and the entire way to work I was thinking, like, is what I'm feeling possibly related to the coronavirus? And in my head, I was, very hesitant to admit that it could be related to the coronavirus. But as I kept driving, I started to think, like, well, if I do have corona, is it really worth going to work and potentially exposing my coworkers or our patients to it? The symptoms started pretty mild. They eventually progressed and got pretty bad. I eventually started to feel chills, fever, headache, migraines, and then eventually the scariest part was the shortness of breath. It wasn't like I was breathing heavy or anything, or anything like that. It was much milder than that, but it just felt like every time I took a deep breath, I felt like no oxygen was going into my lungs. Like, it didn't feel like I could catch my breath, so I just kept taking deep breaths, trying to catch my breath, but it just kept progressively getting worse and worse. And then it started to mess with my paranoia and anxiety. I started to worry about um, whether or not I should be going to the emergency room. It felt like my main airway was being constricted, like I was breathing through a straw in a sense. Um, and one night, I remember I woke up, it was 3 o'clock in the morning, like trying to catch my breath, and I didn't know why. It scared me. I I thought, oh, maybe because I'm laying on my back, but I sleep on my back all the time, so I don't know why this is messing with me now. I got up out of bed, I went down, I made some tea, and at this point I was getting a little bit anxious because I was so short of breath and I couldn't catch my breath. Um, all right, so how do I feel now? I am excited. I know that sounds weird to say, even though you can hear it in my voice that it's raspy. This is not my typical voice. Um, feel good, no headaches, no chills. I'm on my road to recovery, and that is why I'm excited. I'm excited to get back to work because I know that my coworkers need me. Hopefully, we could help relieve the stress on our already overstressed healthcare systems, so that we can help our already overworked and exhausted and understaffed healthcare professionals, so that we can care for those severely in need of emergent medical attention. We stayed at work for you. Please stay at home for us. I I'm looking forward to helping the community and taking care of them and do my job as a nurse to nurse these patients back to health so that we can finally get back to normal. I have the coronavirus. I have been sick for the last 2 weeks, and I wanted to share my experience and hopefully educate the general public a little bit more than they were. And hopefully, someone finds this information helpful, useful, funny, sad. I don't know. Hopefully, someone gets something out of this. Um, and I've I unfortunately have had this pandemic affect my family members and the family members of some of my close friends. And yeah, they are the reasons why I am trying to put this video together to help educate the public, and hopefully I save at least one life for this video.